When it comes to thinking about our own health, gender stereotypes can be very harmful.
I didn't think I had many problems. I didn't eat really well, but generally I was quite healthy.
Because of all the glorious differences between men and women, there is one thing we both share that needs our tender loving care. We all have a heart.
Something terrible has happened. This is shocking to all of us.
We've all heard the horror stories when it comes to the statistics of heart health in Australia, and for most of us, we think it's older men, overweight, drinking beer who are at risk. So I was absolutely shocked to learn that females who might not be that overweight, who might not be that unhealthy, could also be seriously at risk.
This is Elizabeth. She's only 56 years old. She got a terrifying wake-up call after she finally decided to listen to what her body was telling her.
But what I'd do is I'd go for a walk up to the shops, and there's a bit of a hill up there, and sometimes my husband would come with me, and he'd see that I would, go, my chest is really sore, and he'd say, well, do you want to stop? And I'd say, no, I'll be fine. But I would think that, it's not my heart, it had nothing to do with my heart.
In Australia, heart disease kills 4 times more women than breast cancer. And the majority of women don't realise it is their #1 killer. And sadly, a large percentage of these deaths occur without prior warning.
I kept getting the pain in my chest and thinking, this is not right.
Elizabeth waited 18 months before getting her chest pains checked out. And because women tend to develop symptoms of heart disease at a much later stage than men, waiting can be incredibly dangerous.
I'll be fine, the pain will go away. And then, a month or 2 would go by. And in the meantime, he said, go and see a doctor. And then we'd go up the hill again, and the same thing would happen. He'd go, have you seen the doctor? And I said, no. He said, but go and see the doctor.
Cardiologist Dr. Fiona Fu diagnosed and admitted Elizabeth to an intensive care unit within hours of her first examination.
She had a lot of risk factors, but when they did her bloods, they found her cholesterol was high and hadn't really done anything about it. Now, she had 2 blockages in her left anterior descending artery. So subsequently, I stented both of those arteries and they look fine.
Elizabeth's life was saved when Dr. Fu inserted something called a stent into her arteries to clear any blockages. The hormone estrogen has a very positive effect on the walls of women's arteries, helping to keep blood vessels flexible and accommodate good blood flow. Women's estrogen levels drop naturally when they enter their 50s, and according to Dr. Fu, this is when they need to be extra vigilant.
So after menopause, your risk increases. So your blood pressure and cholesterol will go up, and that adds to your risk.
Once you hit your late 30s, getting a heart checkup is really important. In fact, women can experience different symptoms of heart attack to men. While chest pains are common for everyone, women can have shortening of breath, weakness, fatigue, nausea, and even severe pain in their necks, jaw and back. A thorough heart checkup always involves an ultrasound.
So I'm about to put some cold jelly on your chest for the ultrasound images. Okay, so it's going to be quite cold.
All right. It is cold. Yeah. Doctors use this to see how freely your blood is flowing and look for any narrowing of vessels that supply your brain. And then it's a quick 10-minute stress test to really put your heart through its paces.
You're feeling all right?
I'm feeling okay.
Can't talk to me, but
Yeah.
no chest pain.
No chest pain. Finally, it's result time, and I'm genuinely a little nervous.
So you exercised for 8 minutes 40, you did 88% of your target heart rate. So you're above average, which is great.
The news is good, thankfully. But what if my arteries had been blocked? How can I reduce my risk of heart attacks? Well, the gentleman I'm about to meet has some surprising advice.
Garlic's extraordinary. It has all of these very strong chemicals in it that work to stimulate the immune system. They're anti-inflammatory.
Dr. Ross Walker is a cardiologist, and he is a firm believer that this beautifully pungent vegetable can make a massive impact on heart disease.
but also they have some specific cardiac effects as well. The real effect here is on blood pressure and how the blood vessels work.
Now, before you go eating cloves of garlic like apples, you can now find it at your chemist in a concentrated form of aged garlic supplements.
If you have established heart disease, I think you should be having 4 capsules a day to get the reversal effects.
So there you have it, ladies. And in the spirit of sisterhood, here is a 5-point guide to keeping our hearts healthy. Eat lots of fruit and vegetables, drink moderately, don't smoke, keep your weight down, and make sure you exercise for 30 minutes a day.